So the poster I have is about the real world outcomes of myasthenia gravis patients receiving efgartigimod treatment. And I would just talk about a few highlights of this poster. I think the first highlight of this poster is I think it represents the largest real world cohort to date about efgartigimod or about any novel treatments in the real world settings, as we have reported data on 705 patients. And we are able to have such a large sample and report on the data at such a timely manner because we have a lot of support from our patient support program. We basically have most of the data gathered as our nurses are helping patients navigating their treatment decisions. And we have some of these which is called MG-ADL, is a common patient outcomes for myasthenia gravis that was gathered during those conversations to help patients navigate the program. And we also have a little bit of data from the outside patient support program, but majority of data coming from this data source. And in the second part I want to highlight is more on the conclusions on the key findings that I find very interesting about this analysis. I think the first elements we look at is whether or not the type of outcome we see in the real world is comparable to the clinical trial, as that's what most people are interested in. And in this particular analysis, we find that the reduction or the improvements that patients experience are very similar to what we have seen in the clinical trial data of efgartigimod. We see comparable magnitude of reduction in the MG-ADL score, and we also see similar proportion of patients experiencing clinically meaningful improvements. And then the third highlight I wanted to talk about in the findings is in addition to generally comparable findings with trials, we also dive a little bit deeper to look at what is the best state that patients are able to achieve after they receive efgartigimod treatment and compare that with what they were previously. And we do see a significant improvements as demonstrated by these patient-reported outcome measures, MG-ADL. We see majority, more than like 70% of patients, they have moderate to high disease activity prior to initiation. But then at the best state, we see 80% of patients, they were basically in very low disease activity. And at the same time, we also see about 35.5% of patients achieving minimum symptom expression, which means they have very minimum level of myasthenia gravis symptoms as manifested by these particular scale. We've also trying to understand whether there are consistent changes across different body parts, subdomains of the scale, and we find like similar improvements for the ocular, for the eyes, for their breathing, for their bulbar, for their limb strength. So it's generally we've seen substantial benefits as experienced by the patients. And the last piece I want to emphasize a little bit is some considerations when interpreting the data. I think that's more related to your previous question about limitation of the real world data. While I do feel pretty proud that we are able to represent one of the largest real world cohort of this particular for myasthenia gravis patients, there are limitations as is more limited, more representative patient enrolled in the patient support program. And we also don't always have the consistent timing in the capture of the outcomes. So that's the main limitations to keep in mind. I think the take home message is we think from our studies, we find that efgartigimod is effective and it's driving drastic change and improvements for patients who are suffering from the burden of this disease.